Hi, I'm Dr. Caroline Leaf, and welcome to my show, The Dr. Leaf Show. In today's show, we're going to be talking about infertility and how to manage this from a medical and mental health perspective. We're going to be discussing this with my good friend, Dr. Lillian Robertson, who is a board-certified OBGYN. Lillian, welcome back. It's so nice having you back in the studio.
Caroline.
You're one of my dearest friends. You're an amazing doctor, and you're just an incredible person. And I just love it when we get together and talk. The time just flies, and there's so much wisdom that you can share. So I'm so happy you've come back. Thank you.
Well, thank you. Glad to be here today.
Good. Would you mind just sharing with the viewers who you are, what you do?
Well, I'm Dr. Lillian Lockett Robertson, and I am a board-certified obstetrician and gynecologist for the past 25 years. And I work with women from womb to tomb. I'm currently now a laborist, hospitalist in Tacoma, Washington, and work in the area of obstetrics and gynecology, delivering babies and working with midwives and residents in Washington.
Wow, that's impressive. That's amazing. All that experience and all that time that you spend with women from womb to tomb. That made me laugh when you said that, from womb to tomb. Okay, so what we're going to talk about today is we're going to cover the topic of when a woman's trying to fall pregnant, husband and wife, when they're trying to fall pregnant, and then also the topic of infertility. So I'd like to start by asking you, could you talk a little bit about when someone's, if a couple's trying to fall pregnant, what are some tips that we could give them in terms of diet, exercise, mind, from a medical perspective?
Yeah, well, it's really interesting because what we generally, when a young woman comes to the office, the first thing she wants to know is, can I get pregnant? And so we assume everybody can until proven otherwise. And so when we talk about pregnancy, we tell ladies not to stress out about it because, you're built that way. You're built to have babies. And so what we generally will recommend for our young ladies when they come in, we want to make sure that they are aware of when their cycle is and making sure they have some regularity of their cycle. And so we tell them to pay attention to that. We also tell them to make sure that they're taking care of themselves. This is a time where if they are smokers or if they consume alcohol socially, that we're really careful about making sure they are watching that and refraining from that. So you want to be the healthiest person you can be during this time of your life. And so we also have them consider prenatal vitamins and taking folic acid, depending on their age. But it's a time where we're really zooming in and paying a lot of attention on them to be the healthiest person they could be.
So do you find mental health is a big part of that? Because mental health, you mentioned stress, don't stress out about it. We naturally built we designed to fall pregnant, but there are issues that can happen for whatever, multitude of different issues. But stress can be a big factor, toxic stress, because stress is actually good for us. But the toxic stress, which then affects the whole hormonal system. And I wonder how many women are really aware of the fact that if you're trying so hard to fall pregnant, or you're trying for whatever reason, and there's this pressure, the minute that you kind of are anxious about something, our mind then starts changing the way our body functions, specifically our hormonal system. And that can actually block pregnancy. So our mind can almost block pregnancy, can't it? I mean, that can happen.
What happens is that, we as we said before, we assume every woman can get pregnant.
Yes, unless proven otherwise.
Usually after a year, if they've tried unsuccessfully, then that's when we start moving into the thinking about infertility. But what we do tell ladies to do is to not stress out about it, because the chronic stress and the prolonged stress can really change your hormonal environment, and that can impact your cycle. You have to have a good cycle monthly to be able to get pregnant.
That's so powerful.
It's ovulatory time.
That's so powerful. I want to just repeat that the way you're managing your mind is going to affect your hormonal system. So it's really important that this becomes a time of enjoyment, that this is a time of joy for you both, because otherwise your hormonal system is affected, and then it affects your ovulatory cycle. To operate in the regular way that it's supposed to operate.
Yeah. I tell ladies all the time, just assume you can until proven otherwise.
That's a beautiful statement. Assume you can until proven otherwise. I love
proven otherwise, yeah.
That's an incredible.
And so we make sure that they know that that careful efforts and timing the cycle, and being in a healthy relationship is very, very important too, Caroline. Make sure.
Talk about that.
Healthy relationships are so important because, number one, we want to assume that if you're in a relationship with someone and that you're happy and you're ovulating and, the time is right in terms of, you're having healthy sexual relationships, it almost invariably works out. And so when there's abuse and there's stress and there's infidelity, then that changes the stress
changes
pattern.
The whole.
And then when the stress pattern changes the cycle. You're eating improperly. You're not getting the rest you need. And so the body has a way of recalibrating itself, from a physical standpoint if we're out of kilter. And so if our stress hormones are high and it throws off our cycle and, everything just kind of cascade after that.
That would also go for people that are working very high stress jobs as well.
Yes. High stress jobs, because the more stress you're under, it really does impact everything about you. You tend to, a lot of ladies that are in high stress situations, they're not eating properly. They are depressed, or they are really worried. And so then we have stress binge eating and so on and so forth. Everything is thrown off cycle. We are almost cyclic human beings, and we have a circadian rhythm that's very normal for us. And so we have a sleep cycle, wake cycle, ovulatory cycle, menstrual cycle, the cycle of life. So we live in cycles, and so if we are able to manage those and balance those settings, we do better in terms of how we function, how our body functions, and we can get the most out of our bodies when we're able to.
So we can't just keep pushing our bodies and pushing our minds and respond. We've got to really learn to manage that stress, because one of the things that I teach a lot about, and we've spoken a lot about this, is the perception of a stressful event. So you can still, doesn't mean you have to give up your job. I mean, your job is maybe not working for you will be toxic stress. So it's how you're managing, how you're perceiving each situation, because every day is going to be faced with challenges. So we can't turn around and think, okay, well, I'm going to just make my life stress-free, because that's not going to happen. Stress is good for you. You've got to make stress work for you.
Stress propels you forward.
It propels you forward, and life is going to be filled with challenges. So if you're going into that time period where you're preparing to fall pregnant, you need to make sure that you know how to make stress work for you. Stress is so natural as opposed to working against you. Okay, so now what about the person you mentioned something very significant, and they try like that for a year, and they'll do the nutrition and the stress management and manage that job and whatever. But now, let's say they've gone through all of that, and their relationships, okay, all those factors have been in place in the best possible way for that person, because everyone's got their own story. But now they still can't fall pregnant. What is the next step? Well,
the next step first is to talk to your obstetrician if you've tried all the things that you've mentioned, because there's some tests that can be done. When we are, the general obstetrician can generally look at your cycle patterns, your menstrual cycle pattern, and see whether or not you're ovulating. And then also the general obstetrician can also check the male factor, which is the sperm.
Very important, okay.
Yes, that's very, very important. And then the general obstetrician can also check to see if the tubes are open. So tubal patency is a very, very important part of that.
So you said 3 things.
We check ovulatory cycle,
so
whether or not you're ovulating. We check the male factor,
sperm.
The sperm, and then we check to see if the tubes are right, the patency of the tubes.
Okay.
And so once we have checked that, and then still if all of that comes out good, then the next step would be to refer you on to an infertility specialist. Reproductive endocrinologist is what we call them.
Okay.
And so that's further testing, more specific testing that may go into genetic testing, may do more specified blood testing to see what your hormone levels are, and then determine what's next for you. And, there may be more things that are available in vitro fertilization, IVF, so on and so forth.
So there's a lot of different options. What about PCOS?
PCOS is really an interesting factor, because it probably about, I'm going to say about 25% of the ladies that have PCOS will have some complications with pregnancy, maybe
25%.
even more, Caroline, because, these are ladies that have the 3 factors that help us to decide if you have PCOS or not, is whether or not you're able to have regular cycles, or hyperandrogenism, where you have too much male hormone.
Okay.
And thirdly, there's cystic ovaries, polycystic ovaries. So when you have those 3 factors, 2 of the 3 of them, if you have 2 of the 3 of those that are abnormal, then we consider you polycystic ovarian syndrome.
May I ask you a question? Sorry, just for those viewers that just to hear that again, because it's such valuable information. So the three things with PCOS, which stands for polycystic ovarian syndrome, is the multiple cysts on the ovary.
Polycystic ovaries,
which is lots of cysts on the ovary.
Cyst on the ovaries.
Lots of ovaries on the cysts. I said it the wrong way around.
Lots of cysts on the ovaries, and then too much male testosterone in the bloodstream.
Okay.
High androgen levels.
Okay.
And then the third one is anovulatory cycles, where you're not ovulating.
Not ovulating.
Some women can go for a whole year with maybe 3-4 cycles.
Or young girls that maybe start their cycles very late in life,
Right.
18, 19, 20, or
Right.
only have a very odd cycle, are warning signs. So if a young girl is already showing those signs, then it's good to maybe even in advance get checked out for that kind of thing.
Right.
You'd recommend.
So if you've gone through all of the natural factors and you've gotten checked out, and so there's still problems, then we still will look to see if PCOS is one of your concerns.
Indeed.
But we can already have identified that, as you said.
That's what I was going to say. Your as a young girl, and also with the general OBGYN, that could also be identified.
Right. We can, as a general OBGYN, we can identify that and find those patients that may have some risk for polycystic ovarian syndrome. And so then as we refer those ladies, and there are medications that can be utilized to help with ovulation and or really working with the infertility specialist, because again, we're getting back to diet and exercise
wow.
and, checking your lipids and things like that. So more testing, more specific testing is necessary in that group of women that are trying to get pregnant.
Okay, so there's a lot of stuff that happens 1 year later if you're still trying to fall pregnant. So there's a lot of mental preparation that's required. So you want that child, there seems to be potentially some sort of issue. So now the whole diagnostic process, which can take a lot of time and energy and mental strain, begins. And are you finding let's talk about the mental health side of that, because
yeah, the mental health
we don't
side
want
is
it to
really
work against
the mental health side is really important, because some ladies feel really guilty when they're not able to get pregnant right away.
Wow. Yeah.
What I seem to notice with them is that they are, because the community, their family, their village wants them, and they're married, and they're ready to have a baby.
When are you having a
So
baby?
how long have you been married? There's no baby yet. And so there's a lot of pressure. From others, and then there's internal pressure. And it may be that one spouse may want a baby right away, and so if it's not happening, it can really impact your sexual life as well. So is this the night where we get pregnant? Is this the night? And so the performance anxiety is a real issue. And so we have to really help these ladies and support them and say, we believe you can get pregnant. We just need to figure out what we need to do and what steps we need to take. But as we work with these ladies, the mental health component is something really we have to help them through. Some ladies feel guilty. They may have had some abortions early on, and maybe I'm not able to get pregnant because I had, I did something that I didn't tell someone about.
That's a really important point. I'd like to actually take that a little bit deeper. We've just got a quick break now, and after the break, when we come back, I'd like to talk about this guilt and shame related to various different factors, including perhaps abortion and that kind of situation. So we'll be back just after this.
Are you tired of failing? Tired of not getting those good grades, even though you studied for hours? Tired of having all these goals and dreams, but not able to make them happen? Maybe you're just tired of failed relationships.
But the real key to success lies deep inside of all of us, and that is in our mind. If we don't get our mind right, nothing else in our life will go right.
Dr. Leaf's latest book, Think, Learn, Succeed, includes her gift profile and scientifically proven 5-step learning process to help you understand and use your unique mind to find meaningful success in school, work, and life. Order your copy today.
So Lillian, just before the break, we were talking about the guilt and shame that can come from various different things, and you mentioned perhaps someone has had an abortion or multiple abortions for whatever reasons, and now they're trying to fall pregnant and can't fall pregnant, and there's the guilt and the shame. Can you speak to that a little bit?
I had a couple of patients in my practice from time to time that have had abortions, and so in some of the literature that may have some biases surrounding that, they've experienced a lot of guilt because of that, and so when they try to get pregnant once they're ready in a healthier state, then they have that guilt that's surrounding that.
Yeah.
And so we have to help ladies work through that, because that's a mental health thing that we have to get past, and it can really impact performance. It can impact that stress that that's increased as a result of those guilt feelings, can impact your cycle, and then just can throw your whole rhythm off in terms of timing for pregnancy. One of the other things that we will often notice too is sometimes, the women are right away in the office to get checked, but it could be the man. It could be the man sometimes. And so, if we've checked everything with the woman, we've checked her tubes, we've checked her hormones, we always have to look at the male factor. The semen analysis gives us a clue, but sometimes men can really, really shy away from having that test.
Are you finding that? Do you find
I found that in a couple of situations with the male, the macho factor. They are, you get checked, there's nothing wrong with me, because it's a real
the masculinity is being challenged.
Yes,
in our patriarchal society, that can be. So you have to have a man that's confident enough in himself and realize that there's nothing wrong with that. As much as there's nothing wrong with, we can't, this blame game or guilt and shame, it completely distorts every single cell of the body, which means our hormones are going to be affected. And
absolutely,
it's real. Guilt and shame change the way that the body will function.
It does. And what I tell the husbands, Caroline, I tell the wives, I remind them, just say, honey, let's just we're doing this together.
Exactly.
It requires the two of us to come together to make life happen. And so perhaps if there's something that's concerning, we can get it fixed, and let's move forward to making this work for both of us. So you have to kind of prop him up a little bit to have the courage to do that. Not all men, but we see it a lot, and sometimes it could be very, very stressful for women when their husbands don't want to participate, but still are wanting the pregnancy.
They're wanting the pregnancy, but they're not prepared to participate. Do they respond to?
Well, it's been favorable. I've had a patient's husband who has not responded. I don't think he's ever gotten his semen check. No, and as a result, they've not been able to conceive.
So and then that becomes a long-term relational issue, because the wife then is frustrated. So it's very important to actually. So you're doing a lot of counseling as an OBGYN. There's a lot of relational guilt, shame, dealing with your identity, self, etc., trauma. Talk about the trauma.
We have girls that have had issues with molestation, inappropriate touch, and so sometimes it's difficult. Their sex for them is painful. Sex for them reminds them of an adverse bad situation. So you have to help them work through that. There are all kinds of situations, mental health issues that are surrounding pregnancy, infertility, in relations. And so some of my friends call it that you're gyneco-psychologist.
Gyneco-psychologist,
because you have to work with the ladies in their situations and all of the things that they're bringing everything with them and showing up for this time in their lives.
Well, it's a very intimate thing to have an OBGYN check in the first place, and it's a very intimate thing to want a child, and as you said, involves it's involving your partner. There's such an intimate, such a deeply emotional
it's a private we're taught as girls to not show our private parts to anybody, and so then you have to expose and divulge all of those private things about you, your insecurities, is my body okay?
Very vulnerable.
Yes, you're very vulnerable, and so then if something is not happening in terms of the timing where you would want it to happen in life, you bring all that to the situation.
So there's a lot of vulnerability, and then for the male as well, there's going to be the same kind of vulnerability.
Absolutely.
The what's wrong with us, why can't we produce? So there's a lot of that mental health that needs to be facilitated. And I think one of the main messages is to tell people it's okay. When you operate in love, when you operate in tolerance, non-judgmental, let's listen, let's support, it changes. And I know from my work that changes your brain chemistry. It changes every part of your body. It changes how your energy flows through your body.
Right. What's interesting, Caroline? Sometimes when we have moms and dads, they will adopt a baby. I've seen it when they've adopted a kid, and within a year or so later,
they're pregnant.
Because the pressure's gone, the stress is gone.
I love what you've just said. Isn't that amazing?
Able to conceive, and life goes on. But if you take all the pressure out and the performance anxiety and the guilt and the shame and the worry and the stress, man, it's amazing how your body will respond to that. And sometimes pregnancy is just as simple as snapping your finger.
Wow. Yeah. So you show that what you've just basically highlighted is that very strong mind body connection, the mind-brain connection.
Absolutely.
In terms of that. So, and also then, I mean, adoption's a great thing. There's so many babies that need good homes. So that's a really positive factor all the way around there, which is such an amazing thing.
We're really making a positive difference. And then you're helping others, and then you're helping yourself as well.
That's amazing. Yeah. We get so many emails and texts and messages from people that are going through either they're not, the infertility issue or related to pregnancy, whatever. And one of the things that comes up quite a lot in terms of trauma is, because you touched on that as well, is that people go through certain things at certain points in their life, and then falling pregnant brings that memory back, or the process of sex brings that back, or even just the child experience maybe was rejected in the womb, and that brings that back. And there's so much past that seems to flood into the present. And I'm talking now from a multitude of women that have said to me that when they fell pregnant, or when they were trying to fall pregnant, or when they had the baby, all the different stages, pre, during, post, that the traumas of the past seem to whoosh back into their mind, and especially when they're home with the baby, and then there's nailed it back in their busy life or whatever, and there's these traumas that are coming back, and that they had thought they had dealt with, or they thought they had got rid of them, and they felt that was a massive part of maybe the infertility, maybe the so I'm talking about all stages of pregnancy. Have you experienced that as well?
Yes, I have experienced that. I've experienced situations where girls have been raped, and had some difficulty with getting pregnant afterwards.
Is that with so there's the trauma side there?
The trauma side.
And so it takes a lot of counseling for the male and the female to be able to enjoy sex after a situation like that. So they love each other.
They love each other, but it's difficult because it's difficult because in those situations it's tough for them to even relax with sexual intercourse because there's traumatic experience, memories, there's pain. And so sometimes we call that dyspareunia, when it's painful intercourse, because, you're reliving some of those situations. And so when ladies have difficulties, sometimes even in marriage, if they've been, touched inappropriately, now they're married. So the honeymoon's kind of difficult. So we have to, that's a real issue. It's a mental health thing. It's memories, it's pain, it's past, it's trauma. All of that comes on the stage when you are, being intimate with your spouse and then trying to get pregnant. And so some of that you have to sort out. Is that contributing to the irregular cycles? Is that contributing to the infertility in some way? So it's a huge package, but we have to kind of unbundle it.
I see that it's psychogynecology happening over here. Really, you're dealing, so you can't, because every person has a story, and when they're coming to you with a whole story, which shows that the medical profession is immersed in the mind, and we can't separate. We have to have the mind involved in especially when you're dealing with something as long-term. You're building a long-term relationship with your patients. You're not just seeing them once off for a sickness. They are it's relational.
It's relational, and they come to you with infertility, but they're bringing those past traumas,
all the traumas, all the insecurities, the identity issues, the
shame, the body habitus issues, and then the medical problems, the PCOS and the endometriosis and the pelvic inflammatory diseases. So you're dealing with all of those issues, and so you have to just kind of help sort through and walk through and, do the appropriate tests that are related to some of the situations that they're having difficulties in. But infertility is really a strong issue for ladies. It causes a tremendous amount of pain, as we said before. And then one of the tips that I always tell them is that if you can go through a year and not been able to get pregnant, and get referred to the endocrine infertility specialist, again, there's tests. But what you can do until you get there is eat properly. You can exercise. You can make sure you're reading and
getting knowledge, learning about the
and
situation.
then watching your cycle, checking the cycle, making sure you're monitoring and making sure your cycle is regular as you can, monitoring for the amount of pain that's associated with your cycle, because we haven't even touched on endometriosis and how that impacts
maybe
infertility.
Can you touch on that briefly?
Yeah. Well, endometriosis is a medical condition that's pretty common in young women, where girls will have very, very painful menstrual cycles. And when the menstrual cycle is painful, what causes this pain is that we believe that there are implants from the lining of the uterus that can sometimes be deposited on the ovaries and the fallopian tubes and outside of the uterus. And then when you have your cycle, there's an inflammatory change and it causes scarring and a tremendous amount of pain. Though that scarring sometimes can block the tubes, and so during
is it on the deposits, the inflammation and the scarring on the deposits?
On the exterior surfaces of the uterus. And so, and then it inside of the pelvic area, it can scar the tubes, and it also causes irregularity in the hormones and infertility as a result of that in a lot of ladies, if it's not treated early. Endometriosis usually is first diagnosed in young ladies in their 20s, sometimes in their teens. You'll know you have it if there's a tremendous amount of pain and pressure
during
with cycle.
menstruation.
Some girls will start missing their cycle, missing school as a result of pain, and are having to have be on hormones or medications to help with the cycle, non-steroidal, anti-inflammatory medications to help with their menstrual cycle and controlling the pain. But again, that has to be controlled early, like PCOS, so that it won't go into reach infertility issues later on in life.
Wow, Lillian, what I'm hearing you say, amongst a million different things that are incredible, is we need to be very proactive as women. From young, as moms of, I've got 3 daughters, as mothers with daughters, as young girls, we need to get to our OBGYNs early. We need to check for all these things. We need to be checking medically that our bodies are functioning. Because in this day and age, with the exposure to chemicals and bad food and things, a lot of stuff and the mind issues can also change the functioning of the body.
Absolutely.
So we know early on if we can rule out that, identification of trauma early on, management of that.
Right.
And we're talking about loving people, talking to people. And
yes. It's so important to get the education. And so when you go to, I encourage ladies, when you're taking your daughters to the gynecologist, just ask questions. We're not necessarily in there to see if diagnosis is a problem, but we want to make sure the cycles are good, make sure the cycles are regular. Pain is a real issue. Girls can sometimes have pain, and you don't know it's normal until you start talking about it. And so we just encourage you to just get in early, bring your daughters in as early as you can. I think 21 years old is the first time when we are starting to do pap smears now. And so as the more you can know about how your body functions, the better prepared you are and the better position you put yourself in when you're ready for fertility.
I love what you've just said. The more that you can know about how your body functions, and that it's beautiful, that because there's so much stigma in the the religious environment and various different cultures and stuff about women not talking about these things. We need to tell our girls that your body's beautiful, you're beautiful, and let's find out how it works. And there's nothing, let's from early on, let's enjoy our beautiful bodies, and let's enjoy and prepare for healthy sex lives and having children. Have these open conversations. This is something that we proactively need to introduce
into religious settings, and because we've traditionally separated those two, but they are very much a part of being whole mind, body,
exactly, whole mind, spirit, soul, and body. Give us a closing sentence, pearl of wisdom. We've come to the end and we haven't finished. We'll have to do more shows, Lillian. Well, I'd love to have you back again to talk about this women's health and these things. It's so important.
Yes, I'd love to help and come back anytime. I just think that for our young ladies, I want to just make sure that if you're having struggles with fertility, just relax about it and believe that you can get pregnant until proven otherwise. Give yourself at least a year. And during that time where you're giving yourself a year, just monitor your cycles, monitor the amount of pain that's associated with your cycles, good time for nutrition, eat healthy, make sure you're exercising, and make sure, number one, you're educating yourself about what your options are. And then once we go to a point to where we've done all of that, then the next step would be the endocrine and fertility specialist for more testing, and the success comes after that.
Oh, that is absolutely fantastic. Thank you, Lillian. That was amazing. It's such a pleasure having you here. Your wealth of knowledge, and that was really good information. I want to encourage you. Lillian uses this in her practice. This is my book, Think and Eat Yourself Smart. This is really good in terms of nutrition, getting your body ready, helping you when you eat healthy, mentally healthy. When you eat healthy, you'll be mentally healthy. You're preparing your body as well for fertility. We've all got issues. Let's deal with our issues in this book, Switch on Your Brain. I help you deal with these toxic issues that could potentially be blocking you. And in my book, The Perfect You, I deal with a lot with identity, because we really need to understand who we are so that we're strong when we deal with the issues of life, when our self-identity goes for a loop, we lose our purpose, and this can penetrate into the way that we are running our relationships and even trying to fall pregnant. So I encourage you to avail yourself of this information, listen to the show over and over again, and God bless you for spending this time with us. If you haven't yet subscribe and you'll be updated with all things related to the mind and mental health.
Thanks for joining us today. Dr. Leaf's best-selling book will help you find the switch that will turn on your brain and enable you to be happier and healthier in your mind and body, more prosperous, and more intelligent. No diet will work unless you have the right mindset. In the book, Think and Eat Yourself Smart, Dr. Leaf will show you how to eat real food mindfully and develop a healthier body, brain, and spirit. Do you struggle to find your identity and purpose? The Perfect You will help solve life's questions by providing you with a blueprint for your unique mind. Detox your brain in 21 days with Dr. Leaf's best-selling online program, The 21-Day Detox. Accessible from your phone, tablet, or computer, this program will show you how your thoughts impact your spirit, soul, and body. To stay up to date on all things related to the mind and mental health, follow us on Facebook, Twitter, and Instagram. Thanks for watching today, and be sure to tune in next week for another great episode.